Um, well, we're here today talking with two of our third-year pulmonary fellows and just asking a few questions about their pulmonary fellowships and getting some information about what pulmonary fellowship is like here in Milwaukee. So we have Sarah Dawson and Brian Carroll. What's a highlight or a unique aspect from your fellowship years?
You want to go first, Sarah?
Sure, I'll go. Or wait, did you say you or me?
You can go first.
Okay. All right. Well, I would say one of the unique aspects of this fellowship in Milwaukee is that we have two teams. One is kind of the general floor team that also involves our service and the NICU, but then we also have a separate PICU side. And I really like the fact that this program has that separate PICU side because I do like the ICU aspect of it. And so I felt like it was unique that we were really actively involved in the ICU, especially with the trach vent patients.
Yeah, no, I totally agree with Sarah too. You know, one other thing that I think is unique is, you know, I've really appreciated the kind of flexibility that we have to, you know, craft the fellowship and how we want it and kind of what our interests are, what our goals are to kind of, you know, enrich our education. So specifically, we really have a lot of flexibility in determining electives. So for instance, you know, the kind of the subspecialty clinics or multidisciplinary clinics with some of our most complex patients are ones that can sometimes be a little bit hard to get to when you're on a busy inpatient service. And so I think both Sarah and I both did kind of a quote unquote subspecialty clinic rotation where we went around to all our different clinics, for instance, sickle cell clinic, aerodigestive clinic, the trach vent clinic, spent some more time in that. And that really gives you, you know, the ability to kind of see that multidisciplinary approach on the outpatient side, especially. We get a lot of that on the inpatient side. But I think that was really enriching and helped to kind of, you know, at least for me, delve into maybe what niches within pulmonary I might want to pursue moving forward. It was just very, very easy to craft those electives how we wanted them.
What are you proud of from your fellowship? Either an accomplishment or a role, something that may have been unexpected that you got to do?
You know, for me, one of the things that was certainly big nationally, but especially in pulmonary was this whole vaping lung disease epidemic that we've had to deal with, you know, all of us in the last year or so. And, you know, here at Children's Wisconsin, we were one of the first places to kind of find that causal link. And so it's interesting just being a part of the group in general, but I was especially appreciative of how the attendings got me involved early on, not only in helping to kind of see these patients and help kind of craft the initial diagnostic plan, but also in the further kind of you know, community educational part of it. I did several talks to community groups, you know, parent-teacher organizations, discussing the dangers of vaping for teens and adolescents, and also from the academic perspective that dovetailed into a couple of manuscripts that I was able to get submitted and published too. So I was just really appreciative that for kind of something this big and important, they got the fellows involved early on, and we got to play an active role in that.
I'd say a driving role as well, quite honestly, which was really neat to watch as well. Sarah?
I would have to say one of the highlights was I was one of the fellows chosen to present at the Cystic Fibrosis Conference for a fellows presentation. Actually, I did 1 year, and actually Brian was chosen another year. And to me, that was a huge moment because some of my mentors from other institutions were there, and they got to see me present and see how I've grown in the world of pulmonary. And to me, that was very special to have all my mentors kind of in the same room and be able to see my presentation. That I felt like that was a really good moment.
And that was one of the fellows cases. We were very proud of both of you when you were doing those as well.
Yeah, we had a good run with those.
We did. What drove the two of you towards pulmonology, and has your viewpoint of the field changed over these 3 years in fellowship?
You know, for me, I had bad childhood asthma, and so I was actually kind of interested in pulmonary early on. Even in high school, I was kind of thinking Pete's pulmonary, and I don't know if I'm normal or abnormal in the sense that I didn't change all the way through, you know, all these years of training, but So yeah, I definitely had an interest even before, kind of pediatrics residency. But yeah, I think definitely it's grown. My interest has grown and evolved. Asthma is still obviously a big part of what I want to do moving forward, but I've come to really enjoy caring for cystic fibrosis patients, which is not something that I, had a lot of experience with in medical school or before that. And I think just kind of the really complex multidisciplinary kind of special needs children too, that we play such an active role in, was again something I didn't have a lot of experience with before the fellowship, and those have been interests that I definitely want to pursue that I didn't know beforehand. So I think if anything, my interest has just gotten more broad and grown even more.
For me, I've always been interested in pediatrics, and my interest in pulmonary really took hold in medical school when I did a pediatric pulmonary elective. And I was just amazed with all the different physiology and pathology that is involved. And I was really impressed with the multidisciplinary approach, especially for cystic fibrosis and then also aerodigestive. I really liked that aspect of getting everyone involved all together as a unit to take care of the patients. And I thought that was really great. And fellowship just has built upon that and reinforced that I'm in where I need to be and where I feel like I've thrived. And, the pathophysiology and pulmonary I find fascinating and interesting, and fellowship has just gone on to reinforce that.
Yeah, it's an amazing group to watch you guys join. One of my mentors used to always say, there are fewer pediatric pulmonologists than there are professional football players. So it's always fun to watch people joining that field and see how people grow into it and become part of the whole. Why do you feel Milwaukee was a good place for you?
For me, one of the things that stood out was obviously Children's Wisconsin Hospital. When I came here to interview, I was just really impressed by the hospital and everyone that I met. Everyone was so nice. I was impressed on how big the PICU was, how involved our pulmonary department was throughout all the things. And for Milwaukee itself, I had lived in bigger cities before, and I was looking for a nice medium-sized city where you could still get around. You didn't have to deal with traffic all the time. And then there was also like a great, a lot of stuff to do outdoors wise. And I felt like Milwaukee really fit that whole entire picture.
Yes, I think there's enough to do, meaning there's kind of all the entertainment things I like professional sports and going to shows and concerts that come through town. But yeah, it's just also very easy to get around. I feel like you can live downtown and commute to the hospital, or you can live, in a different part of the metro area and very easily around. I think it's some of those quality of life things that are difficult when you're visiting a city to get a good sense of, but it is really nice to have free parking that you can just pull up and it's covered and you just kind of walk right into the hospital. I think that certainly helps my mental health when it gets cold in the wintertime. So, but yeah, I'd say the size, the livability of it, and then it just is close to other big cities too for a quick jaunt. You can take the train down to Chicago. It's not that far to get to the Twin Cities in Minnesota, for instance. So it just has a lot of opportunities and just a great area of the country, I think.
Thank you so much for your guys' help.
Yeah, thank you.
Really appreciate it.